I'm Christine. I'm 22 years old, and I'm currently a second-year medical student at the Pritzker School of Medicine at the University of Chicago. I grew up in Calabasas, California, which is just outside of Los Angeles, and I did my undergrad at the University of Pennsylvania, where I studied both economics and biology. This summer I participated in the summer research program at Pritzker, so I went to Ibadan, Nigeria for 5 weeks. For my research, we were looking at economic barriers to breast cancer care. I actually chose Pritzker because they do a lot of work on health disparities, not only here in the States and in the community, but also globally. I had always had an interest in oncology, and one of the professors at our medical school, Dr. Olopade, does research on breast cancer in Nigeria. So it seemed like a very good fit. So I basically met with her one day, and we were talking about my background, which is in economics. So she mentioned that she was interested in looking at economic barriers to breast cancer care in Ibadan. So that's what I chose to do for my summer research. Before I left for Nigeria, I worked with the Global Health Initiative here to determine exactly what departments I would be working with once I got to Nigeria, and I also did all of my background research and developed the questionnaire that I would be using to interview the patients. When we were in the radiotherapy department, we would basically show up at 9 a.m. and we would go on ward rounds with the physicians. And it was a really eye-opening experience because we got to see such late-stage tumors, the sort of cases that you don't see here in the States because we catch cancer much earlier. After ward rounds, we would then go to the outpatient clinic with the residents. And when we were there, we would work with them in recruiting patients for our study. So basically, after the patients were done with their clinical appointment, we would take them to a different room where we had translators who would conduct the interviews on barriers to care. The most important results were just that medical care for them is basically unaffordable. The out-of-pocket cost per month is 1.6 times greater than their household income per month. So as you can imagine, that's a tremendous burden, and it basically results in what's known as a medical poverty trap because patients are forced to use coping strategies to avoid immediate impoverishment, but this basically just jeopardizes their future household welfare. In addition to that, you can also see these economic barriers affecting outcomes because patients who do have financial constraints were more likely to delay treatment, they were more likely to be non-adherent to treatment, and they were also more likely to underutilize the healthcare system and medical care. And in addition to the economic barriers, there were also significant sociocultural barriers. For example, a lot of patients refused mastectomy because they didn't really understand the reasons behind it. In addition to that, they expected these treatments to lead to a cure. So when the doctors were telling them that their cancer was so late stage that really the only benefit that they would see would be palliation, they often turned to spiritual healing and neglected to do any sort of biomedicine at all because these spiritual healers did offer a cure, although really what you would really ideally see would be patients doing both, dealing with kind of the hopeful aspect via spiritual medicine and then still undergoing Western medical care. There's basically no form of health insurance in Nigeria, so patients have to pay for all medical costs out of pocket, from the cost of drugs and treatment to even the cost of supplies like gloves. So basically, if a patient can't afford treatment, they're referred to social workers. And social workers basically help them get in contact with all of their extended family members and basically ask them to contribute toward that patient's care because everything is out of pocket, there's no insurance. And it was actually kind of nice to see that the extended family network in Nigeria is incredibly strong, and it seemed like they did get a lot of financial support as well as a lot of just emotional support from a very wide group. So I think that the most shocking and surprising part of this experience was just witnessing the severity of the cancer patients that the doctors treat. The patients present with such late-stage tumors. There was breast cancer patients with fungating masses. There was one patient that we saw on the ward rounds who had a nasal tumor that was so advanced that it had put so much pressure on his eye that it was beginning to pop out. So I think just seeing those sorts of cases, I mean, they're the sort of things that you would remember for the rest of your life. So the first people we met when we arrived were the residents in radiotherapy, who were absolutely incredible. We interacted with them a lot at work in recruiting patients, but they also invited us over to their houses after work. We met their families. They drove us around to see some of the sites in Nigeria. So that was just a great experience there. And then when we were in the surgery department, we also met some of the other medical students there, who invited us to some of their student events that were going on during the week. So we were able to see a cultural show where there was dancing from all the different regions in Nigeria, and they included us, I guess, in some of these events because I had a headscarf tied around my head as part of a competition. And so basically overall everyone was incredibly friendly, incredibly welcoming, and I feel like I was really able to make some relationships that will continue until I come back and hopefully in the future after that. So I think that this trip really just highlighted the importance of patient education. The main reason my patients present with such late-stage tumors is that they just can't recognize some of the symptoms, and they don't present to a doctor until the symptoms are so severe and that they're in so much pain that really the only options left for the physicians very frequently are palliation, and it's too late to actually cure the patient. And this actually contributes to further sociocultural barriers. So the great thing about the Global Health Initiative at the University of Chicago is that it really emphasizes the sustainability of these relationships. So I'm basically planning on going back second year after boards as well as fourth year to continue my research and to strengthen some of these relationships. So I would just say just go for it. The Global Health Initiative at the University of Chicago is great, and there's going to be so much support behind you. So there's really nothing to worry about. So just find a project that you're interested in and talk with your mentors, and it'll happen. It'll be great. I was just really impressed with the doctors when I was there. They face so many barriers in treating their patients, and they are so willing to work with them to tailor treatments to their individual financial constraints, their individual needs, sit down and explain to them for really long periods of time why they're doing this treatment, what the potential benefits are, and just really try to educate the patients that they're dealing with. But it's hard because some of the patients don't even have a background where they could possibly understand it, so they're basically starting from scratch. But the doctors are definitely willing to take the time and fight for their patients, which was a really great thing to see. Dr. Fumi Olopade helped me develop the initial research project, but in terms of making the research a reality, there was a lot of support resources that came with the summer research program. So Dr. Callender, Dr. Schneider, and Dr. Shola Olopade checked in on us every other week to deal with any logistical issues or any data analysis issues. In addition, the Global Health Initiative at the University of Chicago also helped with making the initial contacts between our medical school and University College Hospital in Ibadan, Nigeria. And then once we actually got there, Healthy Life for All, a nonprofit set up by the Olopades, helped with initial introductions and some of the logistical things like transport.